Hi, I'm Matt Swearman, and I'm the new Director of Development here at DAP Health. And I'm very excited to meet you and for you to get to know me. A little bit about who I am. I spent a lot of time in my career working for public affairs firms, working for corporate, national, global clients. And I have to tell you that I always felt like I was a little in drag and masking myself, my authentic self. But I'm here to tell you that last night I got to attend our first Partners for Life event, and I felt like as I was introducing myself to attendees, getting to know people, I felt for the first time in my professional career that I wasn't just myself at the office, I was myself with our supporters and the people who help us do the job that we do. And that matters. But you already know that because you are invested in this organization and this community. I'd like to tell you a little bit more about why it matters to me and why this is a good match in terms of mission and vision and values. I grew up in rural Pennsylvania, a little gay boy who didn't know he was a little gay boy, but everybody else seemed to know that he was. And all sorts of unfun things happened. School was not an enjoyable experience. From the moment I got on the bus to the moment I got off, the insults were hurled at me on a daily basis. It was a toxic and abusive environment, and I survived. But as I navigated the real world, it took me a long time to understand who I am and to be my authentic self and also to embrace it. So I've grown, I've had opportunities to value myself and accept myself. I don't like that shit. DAP Health, to me, represents the culmination of all the work that I've been able to do for myself. And this is an opportunity for me to give back to a community that has been marginalized, that doesn't understand its value. And you already get that because you've been part of this community for many, many years. And you've been giving of yourselves, your time, your money. This is a shared value that we have in common, and I look forward to getting to know you, getting to work with you, and getting to make more impact for people who need it so that they can be their best selves. Okay, sorry. Don't put that in there. It's gonna be like Drag Race, and they'll say, don't put that in there, and it'll show up. Damn it. For those of you who've been part of our history for the last 40 years, thank you so much. Because of your generosity, your support, your time, we've been able to make immense impact in our community. Now, for those of you who may have taken a break and stepped away to reevaluate your philanthropy, your values, I would love the opportunity to get to meet you, to get to know you, to hear you, and understand where you are. I understand what it feels like to be that kid on the bus who feels like he's not valued. And maybe that's what you're feeling, maybe not. Regardless, I'd love to get to know you. And I can't remember where to go after that. Oh, got it. I am looking forward to being an active member of this community. You're going to find me at the upcoming Health Equity Walk on October 26th. In fact, I'll be in the dunk tank, so please feel free to come up and dunk me. I'll be at all of our mixers throughout the season, at the season opener, at the Chase event. I look forward to getting to know each and every one of you. And I hope that you will find me or I will find you. And together, we're going to accomplish amazing things. You make magic. I have every faith that you will.